All right. Hi, Genevieve. How are you?
I'm good. How are you, Preston?
I'm doing great. So first of all, thanks for joining us. This is our actually first installment of interviews with the clinician, which I'm really excited about. And I'm so glad to have you as kind of the first guest because I think, you and I have talked prior to this recording, but when you and I were going through the transition of, being a clinician, being licensed, and then getting into more of the medical device space, it's like we really didn't have anywhere to turn. And we didn't really have anybody else's perspective to go off of. So I'm really excited about this because I think what we're really going to give to other people in our shoes is just that idea of like, we've done it. This is what we went through. This is how we got there, and hopefully they can learn something from it. So thank you so much for being here today.
Absolutely. Thank you for having me.
Absolutely. So just to kind of kick things off, you can take as much time as you need, but just kind of give us a background on, what you did clinically, how you got there, and then just kind of what led you over time to wanting to try something different, if we wanted to start with that.
Absolutely. So as you know, I am a registered nurse. I got my bachelor's up at Marquette in Milwaukee in 2015. And then I worked as a nurse in the surgical trauma ICU at Christ Medical Center in Oak Lawn, Illinois. Did that for about almost 4 years. While I worked there, because of my schedule, I also did inpatient recovery room at a smaller community hospital, also on the south side of Chicago. And then because I wanted a better schedule, I looked for some jobs in the outpatient world, which led me to my most current nursing job, or most recent nursing job, I should say, at an outpatient orthopedic surgery center in downtown Chicago. So I worked there for about 2.5 years. So been a nurse for about 6 years or so. And what led me to look at a job in the medical device world was I had so many friends who have these jobs as a sales rep in medical device. And after talking to them about what they do, I'm like, that sounds like something I could definitely do and would enjoy, and that my nursing background would really help me. Like, that would help me a lot in this role. And so it's been on my mind for a while to look into a medical device sales rep role, and the timing was right with this past summer. I was definitely getting a little itch for something new. The outpatient world was great, but with nursing, I was like, I don't really want to go back to nursing school for my master's or doctorate or anything like that. And while there are other options, so many options within nursing to go, maybe try the operating room or something, I was looking for a job with a little more growth in it. And that is what really brought me into medical device. And really, instead of doing a clinical specialist role and doing a sales role, I was like, I want to do the sales role. I think there's more room for growth and a career potential there. And also sales experience. I'm like, I think that could help me if I ever wanted to leave medical device sales and do a different type of sales. It just seemed like a really good role where I could learn and grow and challenge myself, but still make use of my nursing skills.
Absolutely. Yeah. And then to kind of sort of finish that a little bit, because that's really good info. I want to touch on a few of those things, but where did you end up going then now? So what's your role now, and how long have you been there? If we kind of finish off your timeline there.
Yeah. So I work as an associate sales rep at Medtronic in the GI operating unit. So in this company, there's an associate role, and so I kind of describe it as I'm like a rep in training. So this role, I think it's a really great entry-level role for medical device sales. I do get sales experience with it, but I don't have my own territory. I don't have my own quota. My job is mostly to help out the reps above me who do have their own territories and quotas, and help support cases. And by support cases, I mean go into cases where they are using our products, and I'm there to help troubleshoot or help with the staff if they're not too familiar with it. So yeah.
Perfect. Yeah. So, and then that ASR role, that associate sales rep role you're talking about, is that typically, I know it's going to vary by company, but is that typically something where someone's going to stay in that role, or is it something where they're really just being groomed for the next step later on? And if so, what's that timeline like? Is there kind of an average of how long it takes to get to that full sales rep position?
Absolutely. And I think at this company, it's preparing you for that next role as a sales rep, or what we call a SAM, sales area manager. And so typically what I've heard is usually like 12 to 16 months or so, or 18 months for being in that ASR role. I've definitely seen it happen quicker for people to move up into the next level. And I've also seen it take longer for whatever reason, maybe openings or whatever. But yeah, probably a year to a year and a half, I think.
Perfect. Yeah, that's good info. Well, I think you said something previously, and this is one of the reasons I was so excited to kind of start with you as our first guest is, you know my background, we've talked a little bit. So I practiced as a physical therapist for almost 10 years. And I think one of the gripes that myself and a lot of my colleagues had in the PT world is we really felt like there was a ceiling, above us. So, you got to this point, you were licensed, you were a staff physical therapist, and it really didn't matter if you were in the hospital setting, outpatient, home health, skilled nursing. You were either a staff therapist, you were a director of rehab, you might have been like a team lead, but there really wasn't anything else. And I think what's interesting about what you mentioned is you mentioned kind of that, wanting more room for growth. My colleagues and I, we would actually talk about how we felt like nursing actually had a lot of opportunities, right? Like you could go be a clinical reviewer, you could go back and become an NP, you could really go into all these other branches because it seemed like the nursing world just had its fingers in everything. And there were a lot of extensions of what you could do. So that's really interesting to me to hear you say that, like to have a little bit more room for growth. So was there anything specific of why you didn't feel like you wanted to go to some of those other places? Was it more of a challenge, like you were looking for a different challenge, or did you really just know that like clinically was just not something you wanted to stay in for a long time? So I guess a more specific question would be if someone had offered you, with your RN background to be like a clinical reviewer for Aetna, or you could be on the purchasing team for the OR at a hospital, why did you not choose one of those positions, but you instead went more towards like a sales position?
That is a good question. And I think, to be frank, I think the money, like I think with nursing, you make decent money for sure.
Right.
I wanted to make more. And I do love that about nursing, that there are so many different roles you can take. I think the ones that I was looking for, they didn't have as much room for growth. And with that, not as much room for salary growth. I don't know if that's bad to say, but I'm open maybe to a fault about how I'm like, I want to make more money. I can't live off this salary. If I want to have kids and a family, it's a lot. And so I think that I think that also coupled with, I have friends in medical device sales who love it. And I think I knew more about that role than I did about a clinical reviewer or administration within a hospital, something like that. I just knew a little bit more about medical device sales because of friends and family who are in it. And so, and it sounded like I still got to use my clinical skills a little bit in the sense that I was teaching and doing education in services, helping in cases. Like I like the idea of still being in the hospital and being in cases with other nurses and doctors.
For sure. Yeah. And I love that. And we'll touch on a few of those things, kind of like the day in the life, so to speak, in the next few minutes. But, do you find it weird that like we never want to talk about salary? Like we never want to talk like that it's okay just to want more money or like a better financial future? Like why is that? Like I'm assuming you and your colleagues, like as a nurse, like you would talk about that, but like no one ever really wants to say it. Like at least that's what I found.
Yeah. And I think too, like, I think especially in nursing and healthcare, there is a sense of nursing, it's more than a job, you have passion for it and it takes a certain amount of empathy and care. And I think that's true, but I also, and I might be the minority in this, but like a job is for money for me. I don't need to go and put my heart out at my job every single day. In that sense, that the emotional connection I think that nurses have to their job is amazing, but I didn't see it like that as much. But and I do think that talking about money and salary I hope that changes in the future. And I think it does a little bit more. Even when I went to my current job, it was very open conversations about money and salary right off the bat. And I like that. I don't think it's wrong to talk about it. I would never force someone to talk about it with me. And I think it's kind of like some old school manners. And I totally get if someone doesn't want to talk about it, but I just think that it can help make sure that people are getting paid appropriately and equally, and people aren't, slipping through the cracks and maybe not making as much as their counterpart for whatever reason. So
right, yeah, we know there's a lot of gaps there too, right? Like whether it's male, female, or tenure,
Right.
things like that. And
Exactly.
yeah, you kind of, you hit on a big point too. I think in the healthcare world, we want to be altruistic and we want to be empathetic and all these different things. And it's almost like you feel guilty if you have a different desire than just those things, right? Or maybe a different drive is a better way to say it.
Right.
One of the things that really surprised me as I was going through my interview process for the sales rep position where I am now is one of the area managers that I had interviewed with had asked me, basically like what I valued most, like what drives me into making this change. And of course, with my clinical background, right, I list off, that I want to do better by patients and I want to have a bigger impact greater than just the patient that I'm with now. I want it to be more system-wide and community population health-wide. And I get done with my little spiel, with him, and he says, without referencing anything that I had just told him, he literally says, "What about money?" And he leaves it like that, right? So he basically said, "What about money? Like, does that drive you?" And as I thought about it later, it's almost a red flag if that doesn't, right? Because if you're not driven by the money to some degree, then a role like you and I are in, it's not that you'll be bad at it, but you may not be the most effective at it, right? Because at some point you have to have a driving force bigger than just, I want to have an impact, because you're going to have those days where you don't feel like you're having an impact, right? At least I've had some of those. So you have to have another desire, but with a clinical background, you almost are led to believe like that other drive is a negative. Like, I can't believe you just said that, right? Or that you would admit.
I totally agree.
So,
yes, and I used to say that like to friends when I was leaving or thinking about leaving nursing, and I'm like, I'm driven by money. I'm motivated by money right now. And that's the truth. Like, I'm like, of course I want to enjoy my job. I get satisfaction from helping patients and their families understand. I truly do enjoy that part of my job as well, but a job is for money.
Absolutely.
That is, and I don't think that's the most popular opinion. And I don't think for nurses, and healthcare workers, like you said, we're seen and hope to be altruistic. But I will say that was a big motivator for me. I'm like, I want to get in a field where I can have a little more financial freedom. And I know I want to have a family, and I can't help think about that already. So.
Right. No, I love that. Thank you for saying that, because I think that's something that I feel like I would have to pry out of people to share, because we know it's in there, but none of us really want to come forward and actually say that. So that's great. I love your background, of course. So as we kind of get into more of that, so let's take you back a little bit. So you're still as a nurse, you're practicing, you've decided, you know what, like this really isn't for me, and I'm going to start looking for something different. Why did you ultimately decide that like the sales was legitimately the route you wanted to go? So you say that you had friends that you knew that liked it and all that. So as you actually made that leap and you were looking at different true like job titles, what was it about the associate sales rep that you said, hey, like that's what I'm going to go for? That's where I'm going to target my efforts.
So my understanding from talking with friends and people that I knew in the industry, associate was, in my understanding, the entry point for anyone into this role, whether you have experience or don't have experience. For someone like me, it was an entry-level position within a medical device company. And that's what I liked about it, that I wouldn't be going into some big sales role with no experience. And being realistic, I knew associate would be what I'd be going for.
Just a better fit.
Make the most sense. Yeah. And I did apply for some other jobs I applied for a job at CVS, and it was sales, but it was more like kind of like a care coordinator. Like they would go in and someone would have to go home, with nursing care at home.
Mhm.
It wasn't even me doing it. It wouldn't have been me doing the nursing care. It would be me. Okay, I'll find the home health care nurse. I'll figure out what pharmacy you're going to go to. So that
Right.
type of thing is like selling a service. And
Right.
so I did look into stuff like that too. But most of it was entry level to a point. You know, you had to have, they wanted healthcare background, and you had to like have a college degree and stuff. So, but that's,
Gotcha. Yeah.
kind of
So
entry level.
as you did that, and not to cut you off, I'm sorry, Genevieve, but as
No.
you did that and you said like, okay, the ASR is where I'm going to go. I think it's going to be the best fit. Maybe I have the most opportunities and it's just going to let me transition the easiest, right?
Yes.
What strategies did you use at that point to try to get one of those positions? And once you knew that's where you wanted to head?
Absolutely. I talked to people that I knew in the industry, friends, some family members, and just tried to pick their brains about what it would take for me to get an interview. And if, you know, it kept going well in these interviews, you know, what are they looking for? One thing that someone told me that was super, super helpful, and I thought about it through my entire interview process, is they said with these jobs, with these job interviews, you have to go above and beyond. So for instance, the example I got was you provide a PowerPoint presentation but they didn't ask for one. You pitch on one of their products that they didn't ask for, or they asked you to pitch on one, you pitch on 3. Stuff like that to really be a go-getter. I think a lot of people have also said to me, it's hard to get into the medical device world. It definitely helps knowing someone. And I think knowing someone, I think, sounds a little bad, like, oh, I just knew someone, but networking. So at your current healthcare jobs, talk to those reps that you see day to day. Talk to other people in healthcare, find out, you know, how they got into the rep role, and just making those connections. I think you never know which connection is going to lead you to a great opportunity. So just don't be shy about mingling and networking while you're already at work. So
that's a great point. I don't know if you felt this way, but I know when I was going through the process, it's like as a PT, I had a LinkedIn account, but I never used it. I mean, I never even updated it, but I had one. I think I made it in school, you know, as I was in grad school. And I was shocked by how much the medical device industry revolves around stuff like LinkedIn, right? Because especially maybe you don't have those reps you can talk to at your job. Maybe you're more of an office space and you don't see a lot of reps versus the hospital staff. But to me, like LinkedIn was like the resource. And if it wasn't for LinkedIn, I don't know, even the folks that I've talked to that are now reps that have come from backgrounds like we have, like I don't know that I would have gotten the job, you know, without it. So it's and maybe even if it's not getting the job, it's about finding more info about the job or different companies or different roles. Like I actually bypassed an entire company when I was going through the process because of LinkedIn and the reps that had previously worked for that company that I was able to talk with, who basically swayed me against it. You know, like had it not been for that and those connections I made there, these people that I never have met, right? I've talked to them a handful of times through chat and then finally set up a phone call with them or something. Like it really blew my mind how much LinkedIn is relied on in that type of industry.
That is really interesting and good to know. I think good advice. Sorry, I cut you off a little bit.
No.
Good advice to someone in healthcare trying to get into it. Get a headshot taken, because I still don't have one, but I need one. But get on LinkedIn, because I never used mine. I made it and it was like upload a picture. I'm like, I don't have a picture, and that's where it ended. I never used it. And now, you know, I'm on it way more, and it's crazy how many people will chat you up and say like, hey, I see your experience. We have this role. It's just, it can be a lot easier. I didn't know that you used it yours so much to get.
And I think what's really interesting too. I think what's interesting is like, I almost kind of relate the making connections on LinkedIn, kind of like you would cold calling, right? For doc offices or for products or whatever it is. I mean, you may send out messages to 50 reps and you may get 10 that open it. Then you may get 5 that send you a reply and you may get 2 that set up a phone call. Right. So, but it took you 50 touches to get a 4% return, right? Like that's crazy. So I think it's just a good reminder for people that, you know, I would go on record and say you will not get a job without networking. You will not get a medical device job with a resume. You won't even get an interview with a resume. Like that has to be paired with some other type of connection.
Absolutely.
That's my view anyways.
Well, and I really like hearing that you used LinkedIn, because it's not like you even knew someone.
Right.
You just did the work and you made those connections yourself. So it's like active networking, not just like passively, like, knowing people or whatever. Like you put in the work for that, which is so awesome. And like, who knew that LinkedIn could be so powerful?
That's it, right? And like
this is business Facebook.
Exactly. No, and honestly, and like there's so many people that are on it though. I mean, there's so many people that utilize that on a day-to-day basis, like you said, and even you, right? Like you're not heavily involved in it, but you're much more involved now than you ever were beforehand, right?
Absolutely.
As a clinician. So that's, that's something I'll touch on later, like with the group and everyone in the group. But I think that's just a good plug that like you have to be on LinkedIn. And if you're not going to be on LinkedIn, you have to find a way to network yourself, because without the networking, you're not gonna make the connections you need to.
That is so true.
I think now as we kind of go in, so now you've applied for the ASR role, you've decided like, hey, this is for me. What were, in just a general sense, like what was the interview process like for you?
It was the hardest interview process I've ever gone through, only because in nursing, it's never been that hard, because they're like, you're a nurse. Great, you're hired. It's not all that complex. But I would say it was time consuming, because I had to do 3 different rounds of interviews, and one of those rounds was talking to every single person on my now current team and setting up coffees, setting up lunches, stuff like that. Also with my current my nursing schedule at the time, it was really hard to schedule it all because of my schedule at this surgery center. It was very flexible and, all over the place. But it took a lot of prep, and I put a lot of work into it. That is something that I think surprises some of my nursing friends when I tell them about the process. Like I was coming home from work, researching the products that my company used, looking up current articles about the company, looking up, like finding reasons, like, why do I want to work for this company? Like, of course I'm like, well, because I want to get into MedDeviceSales, but that's not what you're going to say in the interview. So finding out, like doing a little digging on the company and finding out their values, recent awards they've won, new technology, things like that. And then breaking out the PowerPoint, first time in like 6 years, probably since college. Like I was like, oh my gosh, I do not know how to make this look nice.
It's crazy though, how much of the extra goes into the process, right?
Absolutely.
I felt the same way, and I'm gonna put out a tutorial kind of in the near future of kind of how I went about that part of my interview. And I did what they call the brag book, like I'm sure you've heard of, and there's different verbiage for it. But I essentially in PowerPoint, I didn't make like a presentation, so to speak, that was going to be like slide oriented, but I made like an entire portfolio of like what the job criteria was of the job I was applying for, how I met that criteria, how I had already met quotas in my clinical world, right? And really try to tailor my talk towards, I've done sales, I just haven't done product sales, right? And,
true. I talked about that too in mine. Being a nurse, I said every day I would have a new patient, a new family member who had different needs, different fears, different expectations of the day. So you had to quickly read that person and their family and figure out what was important to them and how you were going to make them have a successful day. Because in the end, when your patient's happy, you're going to have an easier day. So it would benefit, me as well, to make sure that I, was talking and figuring out what they wanted. So I did the same thing. I'm like, I feel like I'm a salesperson every day. I also, with healthcare, people trust us, or they have to trust us. They don't always right off the bat. So you need to figure out how to gain their trust in order for you and them to have a successful day. A lot of times, like especially in the ICU, patients and their families, they just didn't trust hospitals, healthcare at all for whatever reason. So if they don't trust you, they're questioning everything you do. They don't want to let you do anything. They want to watch everything you do. That's a nightmare of a day for a nurse. So by gaining their trust, they can kind of relax a little bit, leave you alone and let you do your thing. And I think that was one of the hard things about nursing that like no one tells you about. But it made me, it made me better. So it was
right.
good. Yeah.
No, I love that. And I think, it's funny because I think it's like we talk about this group, that we're recording the video for MedicalSales and trying to help some of our clinician colleagues like make this transition. I think that's one thing that made me the most passionate about that is that when I think of clinicians, to me, it doesn't matter if you're a nurse, you're a PT, OT, speech language pathologist, counselor, right? We all have that inherent ability of we have to build trust, we have to build rapport to be effective. And I feel like because of our clinical background, we are honestly better at doing that than most people. Because like you said, we do it with every new patient every single day. And I think when I realized that, especially as I started moving into this role, it's like, man, I wish more of our colleagues knew that. Like, I wish they knew that skill set was going to serve them so well instead of all the perceived fears we have of like, am I going to be successful or do I know how to do this? You don't realize how much of like that skill set contributes to your success. Would you agree with that? I mean, is that something you'd agree with?
And I would agree. Like, I've heard so many times now, sales is relationships. Sales is, it's relationships. It's knowing how to talk to people, and it's being able to read them, get along with them, and be able to like inform them about the product without having it be a pitch. It's like all conversations. And I think that is something like, I think our nursing background or our healthcare background has helped me so much in this role. And the clinical side, yes, but the people side of it has really helped, because also in nursing or PT, you're not talking to like healthy professionals. You're talking to patients who are in pain, they're sick, they're not doing well, their families are grieving or sad and upset, emotional. So not only are you just learning how to talk to people, you're learning how to talk to people who are having like the worst day of their life. And you're still somehow building their trust, building a rapport, getting them on your side. It's a lot of work sometimes, but now it's like, oh, I could talk to anyone and find something.
Because you realize that's like what you're good at. Like, that's literally one of your skill sets. Sometimes we just brush it off as like, oh, I'm good with communication, but like that's truly a skill set that not everybody has, and that you need to have to be successful in this role, right? Like I remember when I was going through the process, I probably feel it more now than I did then, just with what I've gone through. But I've always felt two things. The first thing is that people buy from whoever they like. I think that's a very important thing. And I think what kind of goes alongside with that is that you selling doesn't always have to be a thing, right? I think a lot of times what we sell is we sell an idea more than anything else, right? And so one of my favorite books is called Selling is Human by Daniel Pink. And he goes over that. And I read that book when I was actually a clinician. And then I read that again as I made my transition to medical device sales, because one of his big premises in there is like, you may not go and sell a copier every day, but what you do every day is you are always selling an idea to someone that you're trying to get them to buy. Right. So for me as a PT, it was telling people in pain that they should trust me to roll out of bed and get up and move. Right?
Exactly.
You as a nurse, is that you were selling to them that, hey, like I can really help you with this medication that the doctor has okayed you to have. Like, are you okay with me giving it to you? Right. Like there's many different examples, but at the end of the day, you weren't selling something, you were selling an idea. And I think the quicker we acknowledge that and kind of embrace that, it tells colleagues like ours, like, hey, like, yeah, I've never had a sales role, but I've always sold like every single day. And I think that's just really powerful as a reminder to us that like, hey, just because we've never put it on a resume doesn't mean we haven't done it.
That is so true. And I fully agree. And when I was preparing for my interview, I was, how do I address that I have no sales experience? And that's exactly what I did. I'm like, I sell people every day on my nursing care. And that can be the toughest role of all, because you have people actively not wanting to do it. For you, someone in pain, hey, I know it hurts to move right now, but I promise you moving will make it hurt less. Like, how do you spin that? But that's what we would do every day. And a lot of times with patients, you have to sell the idea. Medication, whatever. No. Physical therapy, no. You have to sell like, okay, what do you love to do? Oh, you love to like play basketball. Okay, well, what do you need to play basketball? You have to be able to get up and move and blah, blah, blah. And you have to like kind of dig deep sometimes. And that, I mean, that's a huge asset that we as healthcare workers have. And I think it is important that people who are interested in leaving the field, I hope they need to know that, because even though we are PT, nursing, the skills that we've learned from that will help us in any job. And it's
Totally
more
agree.
powerful than you think. You just have to know how to phrase it and
Right.
sell it to whatever job you're trying to get.
Absolutely. I couldn't agree more. So, as we've talked about this, we basically kind of aligned how like, wow, your clinical background has now matched with a position in medical device sales.
Yeah.
But as you got into your role, what's something that like surprised you? Like, was there something that, whether just like industry as a whole, you're like, wow, like that really surprises me, or even position or, company specific, something you didn't expect when you got into your role?
I think what I didn't expect is I didn't expect it to be truly so like relationship based, and like it's not as salesy as I would have thought. Granted, I'm an associate, so I don't quite have that quota pressure. I'm sure if that role is in my future, it will definitely feel more salesy once I'm in charge of a quota in the territory. But a lot of it is just, hey, you guys need anything else from us? And they're like, oh yeah, we actually have to throw an order in for this, or just it's way less used car salesman than I would have thought. Even though I kind of knew it wouldn't be quite as pitchy, but it's really just conversational. And like a lot of I think something else that I didn't expect is a lot of the research you do on like a physician who would be a good target for this product, that comes through chatting with them. Hey, what kind of colonoscopies do you do? Are they just standard screening? Like I asked the doctor that a few weeks ago. So do you typically do screening colonoscopies or what? He goes, actually, everyone sends me their really difficult ones. I'm like, oh, okay. So you're that guy. You do those tough, difficult interval cancer patient, you do those scopes like that. And it's that easy to find the next target for a product. On the flip side, that information isn't always readily available. So you yourself have to be the one to go and do it. And you have to be chatty and know the questions asked and gather that information yourself and kind of put together those puzzle pieces and say like, okay, I should pitch them. I should see if they know anything about Bravo.
Right.
It's kind of doing that, where I think in nursing, I was so used to task-based work. Here are the tasks you have to do. Get them done in this amount of time. That's that. Where this job, it's you get what you get out of it, what you put into it. You could just chill all day. No one's like watching you, making sure your tasks are done, but you're not going to make any sales. You're not going to make any money if you don't do that. So that is something that I think kind of surprised me. And especially during the first few months, I'm like, what am I supposed to be doing right now? I'd have a day where I didn't have any case support. I'm sitting at home, like feeling guilty. I'm like, I'm used to working off of like a list or hourly meds to get, so those were just some differences and kind of what surprised me. And I wasn't expecting that from this role.
Yeah, I would totally piggyback on that. I think even still, like I've been in this role for what, 7, 8, almost 8 months now-ish. It's like that still surprises me. I don't think I was fully prepared for like hey, it's Monday and it's 8 a.m. Get after it, right? Like there is no blueprint, like you said. I mean, there's some guidance, like there's some things you're going to have to accomplish, but it's definitely not patient visit based. It's definitely not cases based like it was for you in nursing at your surgical centers and things, right? So I think that still surprises me. Like, and that's still part of what I love is like, I love the flexibility to say like, hey, if I need to get this done from 8 to 10 today, and then I'm maybe going to stay in the field for a little longer, or I'm going to get this done from 8 to 1 today, and I'm going to make tomorrow like my field visit day where I'm really getting out there and setting meetings. Like I love that it's so flexible. But I think even knowing that it was going to be like that and I wasn't going to have my hand held, it still surprised me, right? Like how much it was on me to like come up with my agenda.
Right. That I
You
think
know?
coming up with your agenda and like
Yeah.
even just like, okay, I don't have anything on the schedule next Tuesday. Like, what am I going to fill it with?
Right.
Who am I going to call? How do you figure out who to fill it with, what to do, where to drop in? Like a lot of that, it does take digging and just time. And I did have one of the SAMs on my team tell me, they say the first like 6 months to a year of sales, it's like you're just kind of doing research.
Yeah.
You know, it's like you're just trying to get to know everyone. You can't go in and just right off the bat be like, what do you want to buy? You could, that might work for some people, but definitely not me.
Yeah.
And so that made me feel a lot better about what I'm doing now, just trying to get to know some of these accounts that I'm working with and like have them get to know me, building rapport. And then when it comes to the time a few months from now or whenever to try to make that sale, you can call onto those relationships and you're not coming off as a total creep salesperson. You know, so I don't know, that was interesting hearing that, but.
Totally. Or it's like the example you had of the, the doc that maybe does a lot of scoping for the interval cancers or the difficult cases. I mean, knowing that information is going to help you guide your future conversations with him or he or she, right? So you're not going to waste your time with those things you know that they aren't going to be interested in, but it's going to make you be a lot more conversational when you bring up those things that they probably will be interested in because you actually know their background.
Exactly.
Right? So that's really cool.
Yeah. And then like with those questions, you're like, okay, he does interval cancer, like, or does those scopes, like, oh, did he know that there's like a webinar on like new scope technology? It's stuff like that coming up. And then it's just building those relationships.
Just kind of builds, right? Yeah. And the conversation behind it. So I don't want to lead you with this next question. I want to just frame it very bluntly is what's the best part of your job and what's the worst part of your job? So if you're out with friends having a beer, how would you describe it to them? You don't have to go crazy in detail, but just on a general sense, best and worst.
I think the best thing about this job is I get all the benefits and I get that satisfaction of supporting an account, supporting staff and doctors, being that point person for a product. I loved being that person as a nurse, like having the answers for them, being there to help, being available. I'm a people pleaser. So like that part of it, really, I love that. And I do love the flexibility of the schedule. There is something to be said for being on like a Monday through Friday schedule, similar to the rest of the world. And having that flexibility, I have a doctor's appointment tomorrow morning, like it will be okay. Whereas with nursing, it would, I'd have to take the day off or schedule it on an odd hour. But I'd say that's the best part is I still get that satisfaction of being the support person for products. And then the worst part, I think the worst part is that it is kind of your agenda. You make your own agenda where worst part, like I don't even hate that part of it, but that's just the biggest adjustment for me where, I'm used to having a list of meds to give, skills to do, sessions to make. And that was that. Once I'm done with that, check it off the list. Whereas that list, you're making it yourself and it's also never ending. You could always go and do more and reach out, see one more person that day. So I think like the autonomy right now, it's just a learning curve. I think once I have it down a little bit more, I will love it. Having that autonomy, but it is like a different type of stress. Like it brings you back to like college where you're like, there's always more studying you could do. Like, you know what I mean?
You're never done. Yeah.
There's always the guilt of like, you could be doing more, you could be doing more, you could be doing more. So I think that's the worst / hardest thing about this job.
Yeah, that's really interesting to hear you say that because I totally agree because I think maybe that's a hard way to frame it, right? Because it's not the worst. It might just be the most challenging. It's probably a better way to say it. It's funny to me because you talk about like, you don't have that task list. You don't have that patient caseload list. But
totally.
What's funny though, is if you think back to like when you first started nursing, that patient list or that medication task list, that was your challenging part.
Yeah.
Right. It was keeping up with those patients coming through. It was keeping up with those medications. But over time, you got better with it and it became routine. It was no problem.
So true.
I think you're right. I think it's just a learning curve, but it's a definite challenge to have on the flip side, all of that autonomy and no one really telling you what to do. You having to figure it out somewhat on the fly with some guidance.
Right.
I think that's such a good point of just the challenge there.
Yeah. And
I
think
go ahead.
one more thing, sorry,
Yeah.
is as a nurse, I was used to leaving for work every day. And then when I left my job, I left my job. Whereas here, there are days where I'm working from home. So it's like mixing home life and work, where I'm like, okay, I could probably throw in a load of laundry right now, but then I'll like get sidetracked and I'm like all of a sudden cleaning. I'm like, oh my God, I need to be like, I'm working right now. So figuring out that, like, I never took that for granted as a nurse. Like, when I leave the hospital, leave the surgery center, I'm leaving work. I'm done with work, freedom. Whereas here it's a little bit more, you know, you have your work phone and you could always be checking your emails, even if it's 8 p.m. So I think that's also something that was difficult and still kind of figuring out for sure.
And I think it's like, that's a good point. And I think that's something we probably should caveat and say, like, you know, that is going to be different for every company or division or type of, you know, where you are within the industry, right? Like, I mean, if you talk about like a cardiac rep or a pacemaker rep, they're going to be on call 24 hours a day and they're going to rotate with their team members. So that can be really demanding. If you're maybe in the GI world where the endo unit doesn't open till 7 or 6:30 and it closes by 4, you know, you're going to have a very different lifestyle. I think from my clinical background, like, it's funny that we're kind of comparing and contrasting how you felt with like you'd leave the ASC or the surgical center and be done. It was like, I never felt like that as a PT. I felt like I would go and I would see my patients until 3, 4, 5 p.m. But then I was always coming home to 2 hours of paperwork. And it was every night, you know, and my wife being a PA, she does that still every day. So she may work till 5 or 6, but she's never done because she's never done with what she needed to do during that day other than see the patients, right? So I think sometimes your background plays into that too, where now I find myself, even when I'm printing stuff off or I'm maybe laminating at home or I'm prepping like a PowerPoint for the next day in my current role and it's 8 p.m., I never really even feel like it's working. Because to me, that working and that grind was like chart after chart after chart. And so now that I don't have that, I don't even really view it as like work, right? But that's going to be different for somebody that maybe left at 4 p.m. and then they never had to do anything for the next 5 hours at night. So I think that's just a good reminder and good caveat we should share is like a lot of that's going to depend on your background, where you were and your perspective, but also the division you're in or the company you're with.
Yeah, absolutely.
So that's awesome. Thank you for sharing that. I promise we only have a few more questions left, so I'm not going to keep you too long. But so now as we get more towards, like, a lot of people listening to this, they're obviously going to be like you and I were, you know, months ago or a year ago, where they're like wondering if this is for them. They're wondering if they're going to make it, like where they go from here, how they start, how do they get started. What about your background do you feel like as a clinician helped you in this either process or kind of prepared you for this position? Don't have to go too in depth if you don't want to, but just kind of what, if it was your nursing friend, what would you tell them is kind of their most bang for their buck of why they would succeed in this role?
They would exceed because of their clinical knowledge. So much of this role is based on the products. And it honestly baffles me that non-healthcare workers get hired into these roles because there's just so much to learn. If you don't know anything about anatomy and physiology, like, that is quite the learning curve. I'd rather have the learning curve that we have of like, oh, task-based, whatever, yada, yada. If I had to learn anatomy all over again and learn these products, I think that would be really hard. That is to say, my coworkers who I work with are amazing and they are way more impressive than I am because they did learn this part of it. And I think as a nurse or clinician, that your background of, you know, working with the body, working with humans, that will help you so much in this more than you think. I've even talked to some of my coworkers about, oh, like, this is what I used to like when reps would do this at an in-service. This is what I didn't like. That type of, you know, sight into like a peek behind the curtain of the nurse rep relationship. My coworkers are like, you don't even understand how helpful it is to know that type of stuff because we have no idea. We've never worked in a hospital or anything like that. So I think having any sort of healthcare background will it will take you so much farther than you think. The sales stuff you can learn. You can learn that stuff. You can learn how to do presentations, pitches, use Salesforce, all that stuff. You can learn that, but just the healthcare knowledge, that is a lot more to learn. And so I think that previous background is is a bigger strength than you think.
Yeah, that's good stuff. And I think as I think back to my time before I got hired, I had found a few podcasts that were talking about like breaking into medical device and all these things, but they weren't geared towards clinicians, right? They were geared towards business majors, communication majors, whoever. And it was funny because that seems like it's always a competing theory. Would I rather have someone with a clinical background that I can teach them sales, or would I rather have someone with a sales background that I can teach them the clinical?
Right.
And I can see arguments for both. You know, like if I step back and I take my bias off, like I can see the argument for both. But I think what I always go back to is that it's, to me, like the clinical knowledge matters and like the anatomy and physiology matters, but it matters because when you learned it, you didn't just learn it to memorize it, right? Like you learned it to incorporate it. And I think to me, that's a big difference between someone that has a sales background that's learning the clinical side, is that they're really only learning the clinical side that matters. And they may not really be learning it in the realm of how it is used or how it's viewed. They're just learning esophagus and small intestine and these different things, but not really the bigger picture. And that is where that combined with what we've already talked about of just the selling to people every day that are in pain, the trying to get people to trust you, build rapport, talking to other clinicians and people as a part of the team. I think those two factors to me are what like you really like can't teach. Like I think some of that you can teach the anatomy, but you can't teach the experience around it. Right? Like, am I off there?
No, I think you're right on point with that. And I don't want to sound like people who don't have a medical background like can't do all this job.
Totally.
They do so well at this job too. It is just in your arsenal. It's in our like that's like our strength, you know, whereas some of my coworkers, they've been in sales before, so they know that part of it so well. And what's really nice, what I found, is having a mix of those people on my team. I'm the only nurse on my team. And so I love when I can shed some light to my non-clinical coworkers. But then on the flip side, they have all taught me so much about the sales part of it. So I think it gives you kind of a unique background also. And what I will say is when you're talking to staff and doctors at the hospital, they 100% put their guard down way quicker when they find out that you have a healthcare background. I was with my manager once in a case, and the doctor's like, "Oh, so you're new, you know, what did you do before?" "Oh, I worked as a nurse." My manager said he visibly saw everyone in the room. Oh, yeah, you're one of us, like, you're one of us. Okay, yeah, let's chat, what's up? And so I try to use that to, you know, my strength, like every day, and just try to remember that it's such a strength to have. And I think the sales world can be very intimidating. I was very intimidated by it. And now seeing how much maybe like respect, or how it's a little easier to start chatting with people because of my background, it's made me just it's way less intimidating than I thought it was going to be, you know, and like that has really helped me a lot. And it helps me connect with the doctors and the staff, which is kind of what this job is about in the most general sense. And so that's like a huge strength that we have as clinicians. So use it.
Yeah. No, I couldn't agree more. That's fantastic. Those stories are awesome. Like I love that dropping, right? Like that slyly dropping your background, because it changes things. It really does.
Absolutely.
And so kind of piggybacking with that, one of our last few questions here is yes or no, do you think that your clinical background helped you get hired?
Yes.
Yes. Okay.
100%.
So in 30 seconds, and I'm going to put a timer on you, not because we're going over, but because I want you to like get right to like, what was it about you being a nurse that actually got you hired? So not that you excelled in your job, not that whatever, but why did you get hired because you were a nurse?
Because I have the clinical background, the clinical knowledge of the patients, of products, and I've had that experience but also harping on the fact that I would have to sell my personality and gain the trust of my patients and their families every day. I think that was a huge twist on, yeah, I'm a nurse, I have a clinical background too. No, I'm a nurse, and this is why that's going to help me become a good salesperson, because I know how to read people. That is it.
Yep.
I was like, that would be my biggest challenge of the day. Reading someone, you get some grumpy patients, they don't want to do anything. You have to figure out how to make it work for you and them, and getting that done. It's like, okay, now it's
Right.
easy. Yeah.
I couldn't agree more with that. And I think this is kind of an ad lib. I didn't expect to ask you this, but do you think that your nursing background, like, so now let's say we fast forward 6 months from now and your manager says, wow, like, look how successful Genevieve is. I mean, I can't believe we got her, blah, 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 which they're going to say.
Yeah.
Do you think that you now have helped pave the way for future clinicians to make this transition because of your success? Like, will your manager view the next nurse differently, the next PT, somebody with that clinical background?
I think so. And I think the diversity of the backgrounds on our team is what is so awesome about my current team. Like I said before, we're teaching each other stuff. So I think seeing what a unique and useful perspective I can bring to the table as a nurse, I think that would definitely open up my manager's mind to like a future healthcare worker applying, for sure.
Right. I think so too. I almost feel like
Yeah.
it's kind of like something I've taken on myself a little bit, is
Yeah,
that I want to
sure.
succeed for me, you know, and my family, but I also want to succeed because I want my manager to go back to her peers and her
Yeah.
manager and say like, wow, like, look at this clinician that we brought on the team. And
Right.
we never expected it was going to go this well, but like, look
Right.
at the success that he's had, you know, like, I think that's
Totally.
really cool because like
Yeah.
you, I think there's so many of our previous colleagues that
Mhm.
would do so well in these roles, but whether
Same.
it's opportunity, whether it's fear of the unknown and fear of leaving a profession entirely, like, there's not a lot of us that take that jump. So
Right.
I would love, you know, for you and I and the other people that we
Yeah.
talk with in this group to be those people,
For
you know, on the
sure.
front lines to say
Yeah.
that it can be done. I don't know if you have something you want to share with this, but if you looked back on, let's say 6 months ago, and now let's go a little bit further, let's go like 9 to 12 months ago, and
Okay.
you were on your path to making your transition. Is there anything that, since because of what you know now, that you would change, you know, looking back about how you went about getting to where you are now? Or would you have applied for the same role? Would you have done the same things in an interview? Is there anything you would change looking back?
I think what I would have done, maybe I think I would have started networking earlier. You know, like, I had always kind of kept in touch with some people who I knew in the business, but like, I wish I had just networked a little more, not because I don't love this job, but just, it was kind of like a whirlwind. Like, I talked to someone I knew, one of my contacts, and they're like, okay, we have an opening. Get me the first step of the interview done in 3 hours by the end of the day, and your name will be in the hat. Like,
Yeah.
so I was like, oh my God, like, you know, it was kind of a whirlwind. And like, I'd known that I wanted to do it for so long that I'm like, it could have maybe gone a little smoother. It all went fine. But like, you know, it was just like from 0 to 60 right away. So I guess that, but I think honestly, I don't know. I worked really hard for the interview. That is something like I wouldn't change. I like took it really seriously and like was working really hard on it. Not to toot my own horn, but like, I was like, no, this is it. Like, you got to balls to the wall, you know?
Yeah, because I mean, you probably kind of felt, I didn't mean to cut you off, but you probably kind of felt like I did, where it was like, listen, if this is going to happen, like, and I'm going to make this change, like, it's going to happen now. Like, there is no, like, I'm going to dip my foot in, I'm going to test the waters. If it doesn't work, like, I'll try again in a year. Like, you made the mentality shift to say, like, this is what I'm doing. And if it doesn't work out, it doesn't work out. But I'm not going to let the lack of trying, you know, or giving my full effort, you know, be the reason. I think, and I don't want that point you made earlier to, you know, be glossed over, is that, you know, you mentioned how in the healthcare world, in the clinical world, you almost like get jobs just because, like, you get them because you have a license, right? Especially with the shortage we have of clinicians. But you're right, like, these are not those roles. Like, you do not get that because you made the final interview or because you knew someone in the company. You get it because you made the PowerPoint presentation. You were 5 minutes early to your Zoom interview. You dressed appropriately, right? Like, you had prepped for questions. As weird as it sounds, I think a lot of clinicians that we know and our colleagues with, like, you're not used to doing that.
No.
Interviews are almost like you're interviewing the company to see if you
Yes.
want to work for them, right?
Correct. Yes.
This is some of that. Like, there needs to be a good fit, but at the end of the day, like, they're still interviewing you. Like, there's still 3 other people that are vying that made it to that round of interviews. So I don't want that to be glossed over. It's like, you bring up a really good point with that.
It's so true. And I do tell my friends about it too, or old colleagues, that I'm like, no, it was like, you had to really put in the work for it and like really go all out. You know, I talked to my sister who's in business and my mom, and, you know, was getting pointers for them, because I'm like, I have not had to have a real interview like this in a long time. And so it was definitely the hardest interview ever. But one thing I do want to share to like people who are interested in making the switch, like I've been telling friends who are also, you know, considering leaving nursing, just with, you know, how crazy it's been lately. And I remind them, you can always go back to nursing. You could always go back to PT. That is the beauty of healthcare. That's what drew me into nursing, like right off the bat. It was like, my sister graduated from college in 2008 when there was like 0 jobs ever, like anywhere. And so I'm like, I will do nursing where I will probably always have a job. And you can always go back to nursing. You won't know unless you try. And keep in mind, especially PTs, you have a doctorate.
Right.
Like, I have my bachelor's, you have a doctorate. Like, yes, it is a specific nursing degree, PT degree, but you have a doctorate. You could get so many jobs that aren't related to PT. You have tons of years of education, and that speaks like so well to you as how you'd be as a worker. And like, I think that sometimes healthcare workers feel pigeonholed. They don't even feel, they're like, well, I can't do anything besides nursing because like I went to nursing school. It's like people major in like psychology and then they're in banking, or like, I don't even know. So it's just reminder, like the strength of our degree and like how much hard work is associated with those degrees. That should guide you and that should motivate you. Like, you can get jobs outside of your healthcare profession. You have degrees, you have years of experience and like a good track record as a worker. So just use that. And like, I think people forget that. Like, I've said it to some of my friends, I'm like, you have a 4-year degree.
Yep.
You have a bachelor's. That's
right.
You know, so
yeah, it doesn't matter. Bachelor's, master's, doctorate, like it doesn't matter. Like you have an education, right? Like you have a background. And it's funny you did that. I mean, you kind of knew the segue we were going. I was going to ask you, what's your advice to people? And I love that because it's that reminder of, hearing you say that, I almost feel though too, that's sometimes what makes, I think it's so hard for people like us to make the change, is that it's a great thing that you have all that knowledge in that one silo, but it also scares the hell out of you, right? Because you feel like that's all you know, right? Yet 100%. You just told me when we started the interview, you did one of your last jobs was at the orthopedic surgery center, right? I was in home care. Like I never treated GI conditions. You very rarely ever manage GI conditions, but what are we both doing now? Right. So not only did we switch total like industries of we're not even clinicians anymore, but we also went to a different branch of medicine and a different branch of diagnoses and presentations and look at how we're doing. And I think that's just such a good reminder for people out there that don't pigeonhole yourself, like hold yourself to a high standard, and be proud of your background because you got those degrees, but don't let that specificity of those degrees hold you back from trying something different. I think that's the balancing act we all have to, manage.
Absolutely. Yeah. I totally agree. And I think a lot of times, like some of my old colleagues and friends who are nurses, they definitely don't even think about leaving the world of nursing, which is fine if you don't. But if you're looking for something else, I'm like, you could work as like a wellness consultant. You can work, like you said, for like an insurance company, like a health insurance company. There's just so much you can do. So I think like what you said about getting on LinkedIn, networking, looking at jobs on there are probably a million jobs that a person with some sort of healthcare background would thrive in that we don't even know about, you know? So I think that's really important to just remind people of that. And you can always go back. You can always go back.
It's a good reminder for sure. And I want to thank you because I think a lot of your perspective and input was not only valuable, but I think for a lot of people, it's just good to hear, right? Because a lot of these things that we talked about, like they're not new, they're not novel things, nothing's earth shattering, but because we never talk about them or address them, it's just, you know, it makes it kind of the
Yeah.
unknown. And it's like, am I the only one out there who thinks this? Or if I
Right.
think I'll be good trying something else, will I really be? You know, but you have people like you
Absolutely.
and me here that are kind of solidifying, like, yeah, like don't
Mhm.
have that fear-based association
Absolutely.
with it just because it's different. So
Yeah.
I'll give you a last few seconds. If there's anything else you want to share, maybe that we haven't talked about, I know we talked about a lot. So if there's not, that's
Yeah.
fine. But I just want to give you an opportunity. If there's anything
Yeah.
else, like, you know, someone came out with you, you met them at a happy hour, it was a friend of a friend, and they kind of said, hey, you know, I've been a nurse for 6 or 7 years and I'm just looking for something different. Do you think I would like, you know, medical device sales? Kind of what would
Absolutely.
you tell them?
I would say, I think you'll love it. It will this it will probably not be as stressful as your nursing job. That's something that I like. My most stressful days as a nurse, I don't think anything will ever compare to that. So another good reminder to healthcare workers who are thinking of making the change, I'm like, the stress that you have felt at your job, nothing will ever compare to that because you were dealing with humans and lives, and like, even if it was just like a crazy day and no one was dying, it still has a different flavor of stress than I think other jobs can have. I'll probably eat my words and have like the most stressful day of this job tomorrow, but I think our backgrounds as clinicians makes us tough. And so I think people would enjoy this job because it will feel a little less stressful. It's a different, more mild flavor of stress, if you want to put it like that. And you still get the satisfaction of helping people, helping patients. And instead of working directly with the patients, you're working with the healthcare workers, your old colleagues, the doctors, and being that point person who can help them with anything that they need as far as your products go. And that is something that I found satisfaction with. That was the same satisfaction I got from nursing as well.
Awesome. Yeah, I love that recap. Well, that's fantastic. So if anybody wants to reach out to you, I know that you're in the MedicalSales Facebook group, but if you'd be willing to have them reach out to you, what would be the best way for them to contact you? If, let's say, they're a nurse, they have a nursing background, they just have other questions they can ask.
Absolutely. Feel free. They can shoot me a message on Facebook. I check it every now and then, and I'd be happy to, from that message, set up a call or something like that. If anyone has any questions, I'm more than happy to talk about it.
That's awesome. Well, thanks, Genevieve. That was super good input, great perspective, and hopefully people really take value to what you shared today. So thank you so much.
I hope so. Thank you so much, Preston.
Thank you. Have a good one.
Thanks. You too.
Bye-bye.
Bye.